All right, let's bounce on over to another topic, elastin. Sorry for the bad joke. Hopefully that's not too much of a stretch. Anyway, as its name suggests, elastin is an elastic molecule, and is found in everything that needs to be stretchy, like the skin, lungs, large arteries, elastic ligaments, and vocal cords. It's pretty similar to collagen in that they're both rich in proline and glycine, but it does not have hydroxyproline or hydroxylysine. Another similarity to collagen is that elastin is primarily produced by fibroblasts. So how is elastin made? Well, tropoelastin is secreted by these fibroblasts and then cross-linked to other tropoelastin molecules along a scaffold of fibrillin. It's this cross-linking of tropoelastin molecules which gives elastin its elastic properties. So what happens if you have a defect in the fibrillin gene? This is actually the cause of Marfan syndrome, which affects about 1 in 5,000 people. Marfan syndrome is a connective tissue disorder that mostly affects the skeleton, heart, and eyes. Findings include someone with tall stature, with long extremities and arachnodactyly, which means long, tapering fingers and toes. These patients will also have pectus excavatum, which is a concave chest like you can see here, and hyperextensive joints. They're also more likely to get cystic medial necrosis of the aorta, which you can see here, and this can result in aortic incompetence, a floppy mitral valve, and aortic dissection, which is bleeding into the wall of the aorta. Patients with Marfan's can also have subluxation, which means dislocation of the lens of the eye. Okay, so let's say you have a test question, and there's a tall, thin patient with long fingers and a concave chest, and they present to the emergency department for sudden onset of the worst headache of their life, maybe with nausea and vomiting. What happened? Well, this is of course a patient with Marfan syndrome, and one of the most dangerous manifestations of this disease is a ruptured berry aneurysm. And where did this patient have a berry aneurysm? The circle of Willis. When these things rupture, you get a subarachnoid hemorrhage, so if a Marfan patient has these symptoms, this should be the first thing on your mind. Alright, what other genetic diseases are risk factors for berry aneurysms? The two most important ones for the step 1 are autosomal dominant polycystic kidney disease and Ehlers-Danlos syndrome. Do we commonly do screening tests for berry aneurysms in these patients? Well, this is controversial, but generally it's not recommended, mostly because most never rupture, and there's a significant morbidity from trying to treat them. Alright, back to elastin. So here's a question for you. A 40-year-old woman presents with gradual onset of new shortness of breath and nausea. You order a bunch of blood tests, and you find that liver enzymes are elevated. She has no significant smoking or alcohol history. What genetic disease related to elastin could this be? It might be alpha-1 antitrypsin deficiency. Alright, I'll explain. Let's take a step back. So how is elastin broken down? Normally, elastin is broken down by the enzyme elastase. To prevent elastase from breaking down too much elastin, the protein alpha-1 antitrypsin inhibits elastase, thus preserving elastin. So if a patient has a deficiency in alpha-1 antitrypsin, elastase is overactive and it destroys elastin. This is often caused by a lack of alpha-1 antitrypsin secretion from the liver, and if it can't be secreted from the liver where it's being produced, it will accumulate and cause cirrhosis. This also creates problems in the alveoli of the lung, where breakdown of elastin results in emphysema, especially in patients who smoke cigarettes, since cigarette smoke also inhibits alpha-1 antitrypsin. In this image, you can see normal alveoli on the right and alveoli damaged by elastase on the left side, which is what emphysema looks like. A common treatment of alpha-1 antitrypsin deficiency is intravenous infusion of alpha-1 antitrypsin, and interestingly, this also helps patients who have emphysema caused by smoking. That kind of makes me wonder if infusing ourselves with alpha-1 antitrypsin might keep our skin looking younger later in life.